Welcome to Shape of the City. I'm Diane Gonzolas, and I'll be your host for this segment. February is National Heart Health Month, and to learn about staying heart healthy and the risks of heart disease, let's visit with Dr. Dennis Korpas from the Nebraska Heart Institute and Heart Hospital. Dr. Korpas, thank you very much for being with us today and taking time out of what I'm sure is a very busy schedule. Let's start off with some general questions. Talk about the leading types of heart disease.
When you talk about heart disease, we're looking at certain types of illnesses. When you have somebody who says, I have a heart problem, typically the first thing thinking about is ischemic heart disease, meaning the diminished blood flow to the heart muscle. And in the forefront of those are heart attacks. So typically that's what most people are concerned about. But besides that, we can talk about heart failure, which is the weak heart muscle, and also another third portion is arrhythmias, rhythm disorders, irregular heartbeats. And typically in the heart disease encompasses mostly ischemic heart disease, which is diminished blood flow to the heart muscle.
We'll talk about some of the causes of heart disease. I know most of us are familiar with the common ones, the cholesterol, the being overweight. What are some of the, again, more common, but maybe some that people don't know?
I think when we talk to patients, I really emphasize family history. That's something that's really important, and some people do ignore that. If you have somebody in the family that has heart disease, you have to be extra vigilant. That's something you cannot really do much against. It's your genes. You can do everything else, exercise, quit smoking if you smoke, or never take up smoking, control your blood pressure, know your cholesterol. But I think one thing that's often missed is, if you have family history, if you feel healthy and you are healthy, looking back, who had, like your dad had a heart attack at age 50, those are the times that, you're probably, in that age range, you want to actually have yourself checked out probably, sooner than you would if you didn't have those problems in the family.
What exactly is a heart attack? I know it's a really common phrase, but are there different types?
There are some types, but the basic principle is diminished heart blood flow to the heart muscle. So typically a heart attack is a blockage, a blocked artery, which will not let the blood flow go to the heart muscle. So this is actually a result of a blockage, a plaque, we call them. Cholesterol typically spills out of the plaque, and then you have a blood clot sitting on top of that. So when you have a blockage, some people have chest pain. We talk about maybe an 80-90% blockage. The blood flow is blocked to that extent, but there's still flow. When you have a heart attack, that flow becomes zero. So you have a clot on top of a blocked artery, and you have an emergency. You have actually a certain time within which you have to restore the blood flow, unless you end up with scar tissue and heart damage. So the heart attack is a blocked flow when typically the vessel is completely closed.
And what is that time frame?
The time frame, typically if you get to the emergency room and you have your artery open within 90 minutes, then you will have no heart damage. And that typically is a time, from the onset of symptoms. And if you wait longer, typically after 4 to 6 hours, then you do have some scar tissue down the line. Typically we say you have a pretty good chance. The golden hour, we call them the golden hour, in 1 hour. Typically if you have the blood flow restored within 3 hours, typically you have no heart damage down the line.
Well, statistics say 70% of people drive themselves or have someone drive them to the hospital when they suspect they're having a heart attack. Talk about why it's important to call 911 and the 12-lead technology that we have here that can really reduce your chances of permanent damage.
Sure. Although it seems convenient to have somebody drive you to the emergency room, that's not a good idea. Typically, if you have a heart attack, you can have sudden onset of rhythm problems. So you can actually have issues in the car when you're driving yourself or someone drives you, sudden cardiac death, and if you're in an ambulance, you have a much better chance of making it as if you're driving in your own car. So I think it's very important to call 911. In addition to that, they can get an EKG down the line on the field right on you, and they can actually alert the hospital. They can get prepared for you. They can give you initial treatment such as aspirin, nitroglycerin. So it's very important to call an ambulance. Your chances of making it alive at the hospital are a lot higher if you call 911.
All right. Well, let's talk about who is most affected by heart disease here in the community and nationwide.
Typically people who do have risk factors. The risk factors we typical list age, which is something that you cannot do much about, family history, smoking. Unfortunately, the smoking cessation has really has been importantly increasing here in the U.S. I grew up in Europe. Every other person smoked. So I think in the United States, I was happy to see that the smoking has really gone down significantly. Mm-hmm. What has gone up, however, is obesity. If you look at the obesity trends, it's sometimes very scary. So I think overweight society is a problem, especially if you look at down the south, southern states. I think obesity is definitely, will put patients at risk for a heart attack. Blood pressure, high cholesterol. It's been shown that only about 1 in 10 individuals know their cholesterol levels. So it's important to know that number, and guidelines are recommended to be tested early on. So I think those things are very important.
If you know that you're at risk, say you're overweight, you have a family history, you know your cholesterol is high, what are some things that you can do to reduce your risk?
Know your numbers and do exercise. Exercise is very important. Diet and exercise. I have patients that typically spend 0 time on the treadmill, or some people very faithful about exercising. And what we typically say, you get your heart rate up about 10, 20 minutes, at least 3 times a week. So that's something that's very important. Even 5 minutes of exercise is helpful. Your risk of heart disease will be reduced significantly if you do those numbers. But again, any exercise is better than nothing. Break out a good sweat, get your heart rate up. So those are very important. And you know your numbers, know your cholesterol numbers, know your blood pressure numbers, and eat right. And again, some people are very strict about diet. Some people are not. I think to be reasonable, we always promote fish, a few times a week. Just the so-called Mediterranean diet, which again, it doesn't always have to stick with certain exact numbers. I think be reasonable. A lot of olive oil, fish, and try to reduce red meat. It's hard to do in Nebraska, but that's probably what is important as well.
A lot of people are maybe confused about when to call 911. Talk a little bit about the symptoms of a heart attack, and also a little bit about how the symptoms might be different between men and women.
Yes. Typical symptoms of a heart attack are chest pain, chest tightness. A lot of times when I talk to patients, they say, I have no chest pain, I have tightness. So that's something that's important. Most commonly, people have a sensation that someone's sitting on their chest, pressure, a band, a burning sensation. So that's very alerting. However, a lot of people, especially women, don't have those symptoms often. Sometimes have sharp pains, they have anxiety attack, a type of symptoms. Sometimes they have shortness of breath, pain in their back, palpitations, sensations of rapid heartbeat, just fatigue, and sometimes just anxiety. So I think, if you have risk factors and you have family history and you're a woman and you have those symptoms, it's very important to actually, be safe than sorry. So if you have those symptoms, do alert your healthcare professional, call 911, come to the emergency room. One other thing that's important is sometimes, it's missed. Most commonly it's missed, indigestion. Some people, have a meal at night, they go to bed and they feel that they have heartburn. It's probably just, just some spicy food. Doesn't go away, have to take antacids, still persisting. Some people say, I'll sleep on it, see how I do in the morning. That's a dangerous path to go down. A lot of times when you have those symptoms that will not go away, heartburn, indigestion type symptoms, if you do have your risk factors, call 911.
All right, we're going to get a little technical here. This is a question that your staff sent to you, so I don't want people to think I'm smarter than I am. The difference between a radial versus a femoral treatment approach.
We talk about radial, and femoral, we talk about a heart catheterization. So when you have a heart attack, you put a tiny tube in those areas. It used to be the femoral, which is the femoral artery, which is in your groin. So the femoral means a groin approach. You put a tube in the groin and go up through that way to actually look at your blood vessels. In a heart attack situation, the blockage is there. The clot can be fought with medication, but the blockage does not go away. So, if you have a heart attack, we go up there and then fix the blockage, typically with a stent. And traditionally, that happened through the groin. Still, in the U.S., about 50%, 60% of the cases are done through the groin. In the radial, which is your wrist, the vessels are smaller. It's more difficult to put a tube in there. However, that's a safer approach, meaning that the bleeding complications are less, and also in a heart attack situation, it has been shown that if you actually put the tube in your wrist, your outcomes might be better. Safer approach, less bleeding. This vessel is compressible. You can put pressure on the bone when the radial artery runs, on top of the bone, as opposed to femoral. So that's actually a more convenient, safer approach. Also enables patients to get up a lot sooner. So when you put a tube in the groin, you have to lay flat after the tube is taken out for hours. With the radial, you can sit up right away. Early mobility, patients are more comfortable with that approach, and we do have better results as well through the wrist. So that's the difference between the two.
All right, let's wrap up by talking about where viewers can find out more about heart disease and how to stay heart healthy. I know a lot of us Google things, and we're never quite sure which information that you'll find online is correct. I trust Mayo Clinic, but I'm not, that's the one I usually go to.
Sure. I think there's a lot of good websites that will tell you that. One thing that I think it's important, and it's a nice one, I just looked that up because I had this question, how old is your heart? And we had that question, and there's a website called heartage.me. So you can actually go on that, and you can put on different scenarios, and then we'll tell you how old your heart is. So
it's heartage.me.
Heartage.me.
Okay.
And what typically you want to know how old your heart is. You want to at least look at if your heart's age is matching your age, and preferably younger than you are. Typically those variables are smoking, cholesterol level, family history, height and weight. Again, obesity is a problem. So we put those variables in, then we'll give you a certain age, and hopefully when you get is younger when you are. So that's a good website.
And cholesterol, you probably need your cholesterol number in order to go on that website.
Yes.
How often should you have your cholesterol checked?
Typically they recommend to have that done in the 20s. And I think if your numbers are good, that doesn't have to be that frequently. However, if you're high cholesterol and get treatment, typically after a treatment is initiated, you recommend 6 to 12 weeks, 3 months after, and after that probably at least once a year if you're on treatment. If your cholesterol is good, then probably don't have to be checked that often.
All right. Dr. Korpas, this has been very interesting. People think they know a lot about heart health and heart attacks, but this is learned some new things today. So thank you very much for that. Thank you, and good luck with all the work that you are doing at the Heart Hospital to help people stay healthy.
Thank you very much for the opportunity.